The Rwanda Biomedical Center has announced that starting in April, new antimalarial medications will be distributed to health centers, primary health care facilities, and community health workers as part of efforts to curb the rising incidence of malaria. Olive Nete with more.
Kinyinya Health Center in Gasao District is among the facilities with the highest malaria caseloads, attending to approximately 700 patients per month, while an additional 800 receive treatment from community health workers affiliated with the center. According to the head of the facility, Leonidas Batamugira, some patients who receive treatment return later, reporting that their symptoms persist despite taking the prescribed medication.
After a week of taking the prescribed medicine without any hindrances, you might find that the person still has malaria. Despite following the medication regime properly, they may continue to exhibit symptoms such as high fever, weakness, and headache. If blood samples are taken, malaria parasites may still be present, indicating that the treatment has not fully cleared the infection.
The head of the center explains that although some patients receive treatment for malaria, some still return complaining that they are not cured. Chiwagabaga Hospital, which works in partnership with Kinyinya Health Center, continues to receive malaria patients, including both children and adults, some of whom report that their previous treatments were ineffective. Dr. Hippolyte Bwiza Muhire, a physician at the hospital, who closely monitors malaria cases, explains that the current medications are being adjusted in response to the increasing resistance of malaria parasites to previously prescribed treatments.
These two drugs are alternatives to be used when the first one doesn't work. Changing the drug doesn't mean that the first one has issues. It simply means there is partial resistance, meaning the parasite is not completely killed within the usual 3 days. That is why we use stronger drug to eliminate it, as the parasite is not accustomed to the new drug.
Dr. Aimable Mbituyumuremyi, Division Manager of Malaria and Other Parasitic Diseases, states that the improper use of antimalarial drugs is contributing to the spread of drug-resistant malaria strains.
Sometimes people take medicines incorrectly. For example, taking a dose only once when they were supposed to take it for 3 days. This can lead to drug resistance. A person with drug-resistant parasites in their body may be bitten by a mosquito, which can then carry those resistant parasites. When the mosquito bites someone, it transmits the resistant parasites to them. As a result, a person may develop resistance to Coartem, not because they took the drug incorrectly, but because they contracted the resistant parasites from someone who did.
The Rwanda Biomedical Center reports that a study conducted on a limited group of patients found that only 80% of those treated with a standard antimalarial drug, Coartem, fully recovered. Dr. Aimable Mbituyumuremyi states that plans are underway to expand access to new antimalarial medications to improve treatment effectiveness.
It's not that Coartem cannot treat people with malaria resistance, but rather that the parasite is resistant to the drug you took first. The good thing is that in Rwanda, we start with Coartem. However, for someone who took Purmax first, if they don't get cured, we may give them Coartem, and it may work since they didn't take it initially. Now we have trained doctors in hospitals across Rwanda because cases of resistance, we initially wanted patients to attend hospitals. However, the next step is to train health centers, health posts, and community health workers so they can identify cases of resistance and provide the appropriate treatment. I believe that by April this year, the entire health sector in the country will have been trained. This allows health centers, health posts, and community health workers to have access to the necessary drugs.
ndetse n'abajyanamuzima be bayabasha kuyibona.
The latest statistics from the Rwanda Biomedical Center reveal that in January 2025, Rwanda recorded 83,000 malaria cases. Of these, 70,000 were reported in just 15 districts, with Gasabo and Kicukiro leading the count. Approximately 285 people developed cerebral malaria, a severe form of the disease. Symptoms of this condition include an increased parasite load in the blood, a decrease in red blood cells, anemia, impaired brain function, and damage to vital organs such as the liver and kidneys.